Today we're going to talk about braces. Not orthodontic, but orthopedic. Hi, I'm Michael from OrthoPro. We're going to talk about pediatric bracing. And a lot of parents don't know quite what to do when their doctor says their child needs braces. We have quite a selection and a very good team to be able to tell what type of bracing would be best to approach the difficulties that children encounter when they're trying to ambulate. Let's start with types of braces. And they are sometimes diagnosis specific. For example, if your child has hypotonia, or they're having difficulty getting their feet up underneath them, the type of brace that helps would be a supramalleolar orthosis, or SMO. And what it does is it basically creates an environment for the feet to be in position to help your child ambulate. You don't want them sitting on the sidelines because they don't feel comfortable running and playing with their friends. They're afraid that they may trip or fall. And that's pretty sad when we can do something to help them feel confident and have the support that they need in order to be more active. From there, we go up the leg a little bit higher in an AFO, which is an ankle-foot orthosis, and it comes down the back of the calf and under the foot. We have a system of casting the patients and helping to get the proper fit, which is a custom AFO, so that the child doesn't have problems where there may be an area that is causing rubbing or discomfort, but it fits perfectly. It wraps around the foot, holds it in the right position, and it keeps the foot from, for example, dropping so they don't catch their toes and trip when they're running, or may help stretch them out if they, for example, have tight heel cords. Various diagnoses such as Down syndrome or cerebral palsy and others can be treated in this manner with a custom AFO. One of the fun things for us to do is see these patients on a regular basis because, of course, children grow, and as they grow, we keep up with them and grow with them. We do have pediatric rooms, which are a little bit more fun for the kids and the parents, and that helps alleviate any anxiety. When the parents are there, our practitioners see the patients and help put them at ease and actually allow them to pick various colors or designs for their AFOs, which makes it a little bit more easy and acceptable for the children. During the casting process, the children are seated and appropriate socks are put on. We want to be safe, so there's a safety cutting strip that's put in place, and then the leg is wrapped with a flexible urethane casting tape. Once that tape is set, it's cut off and removed from the leg, and sometimes the kids don't even notice what's going on. They may be playing with their iPad or playing with Ben, one of our practitioners. Once the cast is taken, we can take it off the patient and evaluate it, make sure it's got the right angles for us. We want to make sure that the heel's in the proper position, that the toes are aligned properly, and this particular cast has a plate inside it so we know landmarks exactly where the ball of the foot is, where the toes hang over the edge, etc., and make sure we have a good placement of that heel. Once the cast hardens, it's taken off the patient and stapled back together. Then we fill that with plaster, put a pipe in it, remove the casting material, and now we have a plaster model that can be modified to the specifics of that particular patient. After that, the designs are placed into the plastic, so they're actually part of the plastic under hot temperatures and then vacuum formed over the model. That plastic is then removed off of the plaster model and becomes the brace once it's trimmed out and the straps are put on. After that point, the patient comes in and the fitting is performed, and any minor modifications or trimming happens to make sure that we have an optimal fit and function of that brace and your child receives the support that they need. If you've been told that your child requires braces, please give us a call or visit our website.